So primary hemostasis is basically the formation of the platelet plug. So first step is a vascular injury. So vascular injury lead to the formation of the platelet plug. So fibrinogen links the platelets through the GP2B3A receptor. Then this soluble fibrinogen is converted to the fibrin, and this is known as a coagulation. So coagulation can be take place through the two pathways, that is a intrinsic pathway, because all the factors that activate this pathway are present within the vessels, like collagen, platelets, while extrinsic pathway, the activator is not present within the blood vessel. So activator of the extrinsic pathway is a tissue factor. So these two pathways then ultimately lead to common pathway. That is a common pathway, and it ultimately convert this soluble fibrinogen into the fibrin. Okay, deeper into the coagulation. So coagulation can take place to the extrinsic pathway. So what happen in the extrinsic pathway when the vascular injury take place? It expose the tissue factor, right? So calcium convert the factor 7 into the activated factor 7A. Then this factor 7A bind with the tissue factor and form factor 7 activated tissue factor complex, and then again calcium, the presence of the calcium, it will convert the factor 10 into the factor 10A, that is an activated factor. Okay, so here this is a common pathway. So before discussing the common pathway, first we discussed about the intrinsic pathway. So what happened in the intrinsic pathway? So all the factor that activating this pathway are present within the vessel, like collagen, basement membrane, and activated platelet. So negative collagen uh, contact with the factor 12 and it's converted into the factor 12a, then this factor 12a converted into convert the factor 11 into the factor 11a. Then this 11a activated factor convert the factor 9 into the factor 9a. So these star shows that these steps require calcium. Okay, so factor 7a then ultimately that react with the factor 8a, activated factor 8a, and convert the factor convert the factor 10a to the factor 10a. Okay, so again, this factor 10a in the presence of the factor 5a convert the prothrombin, that is a factor 2, into the activated factor 2a thrombin. So this thrombin ultimate convert this fibrinogen into the fibrin. This fibrinogen is soluble and this is insoluble, and then the aggregation of the fibrin take place. Then ultimately factor 13a and calcium form the fibrin mesh that stabilize the platelet plug, right? So now I'm moving to the super high yield stuff related to the coagulation. So these are high yield drugs. So what is the mechanism of action of the heparin? So heparin basically inactivated factor 2 and factor 10, right? So it will inactivate the factor 2A and 10A, right? So some drugs only specifically inhibit the factor 10A. So these drugs are apexiban. So apexiban is a drug that inhibit the factor XA only, 10A only, while the some drugs that only inhibit the factor 2A, dexthrombin inhibitor, they are direct thrombin inhibitor, they are dabigatran. Dabigatran, dabigatran. Okay, so there is another drugs that act on this coagulation pathway. So these are again a high yield stuff. So normally what happen? So the Feb plasminogen is converted into the tissue plasminogen, into the presence of the tissue plasminogen activator into the plasmin. Then this plasmin degrade this fibrin, and in this way it will uh, uh, damage the coagulation, right? So what are the drugs that activate the conversion of plasminogen into the plasmin? That are ratiplase, very high yield drug, ratiplase. Okay, so some drugs that inhibit the conversion of plasminogen into the plasmin, these are again very high yield drugs that are caparic, aminocaproic acid. So aminocaproic acid, and another drug is tranexamic acid. Tranexamic acid. Okay, so these are some high yield drugs related to the coagulation. Now, the one another thing that are the kinin cascades. So what happened? The kallikrein convert the high molecule kinagen into the bradykinin. This bradykinin ultimately lead to the vasodilation, permeability, and there is a disease C1 esterase inhibitor deficiency. So C1 esterase inhibitor deficiency lead to angioedema. It will lead to angioedema. How it will lead to angioedema is a very simple, but it is a very high yield. So C1 esterase inhibitor normally inhibit this kallikrein. This kallikrein, what it will do, it will convert the high molecular weight kinagen into the bradykinin. So if C1 esterase inhibitor is not present, so it will excessively convert into the bradykinin, and in this way it will lead to increased vasodilation, increased permeability, and pain. So this C1 esterase inhibitor is also affect the coagulation pathway to inhibiting the factor 12A and factor 11A activated factors, right? Okay, so now I'm moving to some high yield pathology that is linked with this coagulation pathway. So the hemophilias. So hemophilias are basically uh, the deficiency of the certain clotting factor, like hemophilia A. So factor 8A is deficient, while hemophilia B factor 9 is deficient, while hemophilia C factor 11 is deficient. So high yield stuff related to these hemophilias are the hemophilia A and B are X-linked recessive. So these two are X-linked recessive. So X-linked recessive, it means that it will be more present. It will be more present in male because they are X-linked. X-linked. That is again high yield stuff. So hemophilia C is autosomal recessive. It will affect the both. It will equally affect on the both genders. Okay, so hemophilia A increase the APTT. We will discuss these two things, APTT and PTT, in detail. Okay, let's discuss about the PT. So the PT monitors extrinsic and common pathway that we discussed already. So the factor 1 to 5, 7 and 10, right? While the PTT monitor the intrinsic pathway and the common pathway. So it will reflect the activity of all the factor except 7 and the 30. So PTT raised in hemophilia, right? So it will raise in hemophilia, while PT raised in warfarin. Okay. So both PT and PTT are raised in vitamin K deficiency. So that is again a very high yield. So hemophilia, again hemophilia present with hemarthrosis. Hemarthrosis, that is a joint bleeding, easy bruising, and bleeding after surgery or trauma, particularly the dental surgery.